Hi everyone, this is the Real Deal Sex Ed, and today I wanted to talk with you guys about the sexually transmitted disease, genital herpes, which can be caused by two types of the virus, which is herpes simplex type 1 and type 2. So type 1 is mainly oral herpes, which is usually contracted in childhood or young adulthood through non-sexual contact, such as saliva. So you can pass type 1 to the genitals by means of oral sex. So that's why some types are type 1, but mostly type 2 is through vaginal and anal sex, and basically is where you get infected by coming in contact with a herpes sore, saliva from a partner, genital secretions, as well as other skin areas that have the open infections or sores. Now, with herpes, basically you get these outbreaks, and they are very painful sores. Usually, if you do have any symptoms where you don't have the sores, but you still are beginning to have an outbreak or at the end of an outbreak, you may have flu-like symptoms, discharge, maybe very odorous, things like that. So, with most STDs, to decrease your chances of getting it, of course you want to use protection of barrier methods. But with herpes, the sores in places that are not covered by, let's say, a condom of sorts. So you do want to be communicating with your partner, making sure that you guys have been tested, you have your results, you've seen them, things like that. If you are dealing with someone who does have herpes, they do have medicines that the partner can take to decrease their chances of having an outbreak. If they do have an outbreak and they are taking medicines, you want to wait until they have taken all of the medicine fully before you participate, because even though the sores may be gone, they may be healed. It kind of heals from the outside in, I'll say that. So even if the sore does not appear anymore or it has healed up, you still want to make sure that the infection itself has been cleared so that you can avoid transmitting the disease. Like, I know of times when people have been taking the medicine and the sores healed up, so they're like, okay, I can have sex with my partner, had unprotected sex, and their partner got it because they were not done taking the medicine. They did not follow the directions of the healthcare provider. So you always want to make sure that you definitely complete the medicine regimen, or your partner if you don't have it. But yeah, so protecting yourself against this. They do not have a cure, so you will always have herpes. If you have it, the only thing you can do is control the outbreak, which will control the spread. Any comments, questions, topic requests, you can email me at therealdealsexed@gmail.com.